I'm Michaela.
And I'm Britton.
Today we'll be discussing interprofessional communication between pharmacists and other healthcare team members and its importance in the issue of polypharmacy in older adults.
The framework we are using to examine how pharmacists and healthcare professionals can aid in stopping polypharmacy is the National Interprofessional Competency Framework. This framework provides an integrative approach to describing the competencies required for effective interprofessional collaboration.
Within this framework, we'll be focusing on the domain interprofessional communication. Interprofessional communication is defined as learners, practitioners from different professions communicate with each other in a collaborative, responsive, and responsible manner. Two descriptors of interprofessional communications are actively listening to other members, including patients, clients, and families, and communicate to ensure common understanding of care. Polypharmacy can be defined as taking 4 or more different drugs that have the potential to interact with each other. Why is polypharmacy harmful in older adults?
It is important that the side effects are always considered when prescribing medications for older adults. If there is any doubt about the appropriateness of the medication, it should be omitted and further advice should be sought out immediately. The single most important predictor of harm in the elderly from adverse drug reactions is the number of prescribed drugs. So how can we stop polypharmacy?
As stated in the article, Reducing Inappropriate Polypharmacy, the process of deprescribing. The definition of deprescribing is systematic process of identifying and discontinuing drugs in instances in which existing or potential harms outweigh existing or potential benefits within the context of an individual patient's care goals, current levels of functioning, life expectancy, values, and preferences.
When should a healthcare provider consider deprescribing in older adults? A new symptom of clinical syndrome suggestive of adverse drug effects, manifesting advanced or end-stage disease, terminal illness, dementia, extreme frailty, or full dependence on others for all care, receiving high-risk drugs or combinations, receiving preventative drugs for scenarios associated with no increased disease risk despite drug cessation.
How can a pharmacist use interprofessional communication to stop polypharmacy? Pharmacists can work as a team with other healthcare providers to give the best possible care regarding medications by educating the client on making an up-to-date list of medications and the reason those medications have to be prescribed, identify when polypharmacy may be taking place, understand why older adults in polypharmacy are harmful and how they can help, know when deprescribing medications is appropriate.
Our concluding message is to stay in communication with various healthcare team members and to voice any concerns when you have any questions.
Boom! Thank you for watching.